Yeah, so we're at fibular head. Sure. Wait, didn't I copy you? Yeah. So you just remember it. All right, so we'll have two more bony landmarks, and we'll go through the soft tissue of the knee, and then you guys will practice knee structures and the hip, and the next time we'll do the foot and ankle. And that's it. And then the following week we have our test. So it should be pretty straightforward. Knees a little bit trickier, because when we get to the kind of posterior aspect of the hamstring muscles, gracilis, I'll kind of show you how to differentiate those tendons. So fibular head, okay? Patella, lateral femoral condyle, and then I come straight distal in a vertical line, and I come to a bump. That's the fibular head, okay? It's a little bit more prominent posteriorly. If I wanted to kind of roll over my finger, just like the radial head or the greater trochanter, I can externally rotate the tibia a little bit. You don't have to. Okay? So fibular head should be a good bony landmark as a reference point for some of our other structures. Gerdy's tubercle. What inserts that Gerdy's tubercle? A Gerdy? It's going to be here. It's going to insert over here at the hip, travel down the outside part. IT band. So if you look at the your manual, sitting position, anterior approach, same position as the patella. Start at the base of the patella and move to the lateral femoral condyle, and just place your finger in a vertical direction. So I'm going over femoral condyle. I'm coming down like I'm about to palpate the head of the fibula, but then I go over a little bit more anterior, and there's a small bump right there. And you can almost see Katie's here. And that's the Gerdy's tubercle, or also known as lateral tubercle tibia. Okay? Pretty easy, not too bad. Medial MCL and LCL. So the MCL is going to be on the medial aspect. Same thing. Kind of the middle part of the patella, or the apex of the patella, and I come over to the medial femoral condyle. I come down a little bit, now I'm on the joint line, right? And so kind of in between the femoral condyle and kind of this tendon here, that's going to be kind of a reference point for these three muscles. It's called the pes anserine, kind of, I guess it means goose's foot. What are the three muscles that attach at the pes anserine?
Sartorius, gracilis, and semitendinous.
Good job. So sargent, so SGT. Starting more kind of superior, sartorius, and gracilis, and then tendinosus, so SGT. So in between that pes anserine and the femoral condyle on the joint line is where we'll feel our MCL. To expose it a little bit, we'll kind of try to open the knee joint by putting her knee kind of at a valgus stress. So I can ask her to kind of, rotate her leg out. You see her hip also rotates. So sometimes, I might block her and kind of, bring her leg this way to open up that part of her knee. So if I'm testing the MCL, somebody strains their MCL, tears their MCL, I can do a valgus stress test to see if there's pain involved or the ligaments involved. So I'm here, and then I just, with this, like in the hand, you can really kind of move the hand to expose a ligament. With the knee, there's not a lot of degree of movement into that deviation, because the MCL and LCL are usually pretty tough, pretty strong. MCL attaches to the medial meniscus and the capsule, so it's kind of, in the knee joint, or kind of the fibers go into the knee joint, where the LCL is kind of its own separate entity connecting the femoral condyle and the fibular head. So I think your notes say that MCL is a little bit, easier to palpate. Once you get in that joint line, kind of strum it a little bit, and you'll feel kind of a round structure or kind of a tubular structure right there. I think that LCL is a little bit easier to palpate, Because once you find the lateral femoral condyle and you find your fibular head, it's right in between those structures. Instead of trying to, put a varus stretch on the knee, what you can do is just ask the patient to cross their leg. And I feel like that's a lot easier to feel. And you see how dense and firm this is. It's almost like, is that a bone? But it's a ligament. And MCL is usually a little bit frequently more torn than the LCL due to its attachment with the meniscus and kind of that valgus force that we get when we tear our ACL. We have kind of the terrible triad of the knee where you get an ACL tear, MCL tear, and a medial meniscus tear. So that's MCL and LCL. Last class, they're having a kind of difficulty palpating it. Like, just know that if you know that it's on the joint line in between the condyles and the fibular head and the pes anserine or the tibial plateau, that's where you need to be, and just move the knee accordingly. Like, it's going to take practice to actually feel the structure. This one you should be able to feel right off the bat, but the MCL is going to be a little trickier because you're going to feel a joint line, and then I feel a space there, but is that it? And am I palpating correctly? That just takes practice. As long as you're there, that's all that's all you need to worry about for right now. But keep practicing on different classmates and friends and family, and you'll get better at kind of picking out that structure. All right. Sorry. Okay.
Yep.
All right. Let's go to the biceps femoris. Is this on the lateral or medial part of the hamstring or posterior leg, knee? Biceps femoris. Lateral, yeah. Because the stringy one on the medial, that's the semitendinosus. So femoris is nice because it kind of stands alone on the outside of the knee. In your notes, it asks you to do medial and lateral rotation of the tibia. For the tendinosus and femoris, we want to make it as simple as possible. So we're just going to come to the back part of the fibula, and I'm just going to have her resist knee flexion. And her femoris is going to pop right into my finger. Okay? So I don't really need to do lateral rotation because it's really the only big structure on the outside of the knee. And you should be able to palpate this without resisting, but during the examination, if you have a tendon or a muscle, make sure to have them perform the action. If you have a ligament, move the joint in the opposite direction to expose the ligament. Okay? So femoris, if you get it, smile because you know it's going to be by itself on the outside, and you don't have to go in between or around any structures. You just go to the back part of the knee, maybe posterior to the fibula, lateral of the popliteal fossa, and resist knee flexion. Okay? Go ahead and lay on your stomach real quick. You're going to be on your stomach and sitting down a lot.